Hi everyone, good morning guys. I hope I'm audible and visible to all of you. Please do give me an okay or a thumbs up in the live chat box if the AV is working fine. And I want to welcome all of you to the favorite timing of most of us, and that is the 7:30 a.m. Kickstart morning session. So I think it was much awaited, and at least if we could take out a day to come back to this particular timing, I think it works well for all. So what do we have planned for today? We have spotter cases. We are going to have 15 to 17 spotters, images that we are going to discuss, which are going to be important whether you're preparing for INI-CET or you're preparing for NEET or FMG. I've got a bag of images which caters to every subject. So whichever exam you're preparing for, this session is certainly meant for you guys. Okay, so having said that, yes, I'm just awaiting for the confirmation, and if yes, then we'll start. Okay, so most of us are joining in. Yes, perfect. Okay, so for those who want the PDF, yes, certainly the PDF will be made available over the Telegram group, so you need not worry about it. As many of us are still joining in, I just want to update you guys regarding a new batch that is starting for the first time on Unacademy, and that is a doubt clarification live batch for all the 19 subjects. Any academic, non-academic doubts that you have, you can put it up over there. This will be under the Plus subscription. Apart from that, there's also a NEET PG TND batch that is going on for the repeaters. This will also be available under the Plus subscription. So in case you wish to join any of these, you certainly can. Okay. Having said that, yes, so as I see now everyone's joined in, and the class duration and PDF are two important questions that everyone is asking. So yes, the PDF of the class will be available on Telegram after this, need not worry. Duration of the class, I can't say, but I think 45 minutes we'll be able to wrap up the questions. Okay, so let's begin with question number 1. This is a spotter where there is fat in the heart. So you need to tell me which disease. Now we are starting with the toughest. This is for INI-CET. Fat in the heart, that has been mentioned. So you can see there's a section of the heart. There is yellow color fat that I can see all over. So this over here is fat. And when I look at it under the microscope, all this white area, this is also going to be fat. So why is there fat in the heart? So I am yet to get a correct answer. Someone says coagulative necrosis. See, for coagulative necrosis, you have to see dead tissue, right? Dead tissue is not there. Over here, you're seeing white color, all fat. So this cannot be a case of coagulative necrosis. Next question, familial hypercholesterolemia, but there is no history of the familial component. And heart being the only organ shown out there is also not correlating well. Finally, yes, we've got an answer. Firstly, let's find out what are the conditions where fat can be seen in the heart. Okay, so there are 3 conditions that should have come to your mind. Number 1, fat comes in the heart as a part of cell injury. Whenever there is some kind of cell injury, there will always be a fatty change. Cell injury of any organ. Any organ cell injury is going to result in fatty change. So for example, if this is the heart, and all of us obviously know that the heart is nice and red in color. So if this is the heart, and now I say that inside the heart, fat is getting deposited. So you will say, ma'am, for the identification of fat, we'll use a yellow color. So for example, this is how fat is getting deposited. So is it giving something like a tiger appearance, stripes appearance, red and yellow, normal fat. So that is why this is referred to as the tigered or the tabby cat appearance. These are seen in cases of cell injury. So this should have been one of your diagnoses. But when I see over here, I don't see any stripes. I just see this is an area. So if I orient myself, the thicker one over here must be the left ventricle. This has a very thick wall, and automatically this then becomes the right ventricle. So the fat that is coming in the right ventricle, not in the left ventricle. So is there any condition which I know related to right ventricle only? Yes, there is something known as arrhythmogenic right ventricular cardiomyopathy. Like I said, arrhythmogenic right ventricular cardiomyopathy. This tends to show involvement of the right ventricle only. Guys, this was the answer that I was expecting from you all, because right ventricle में fat था. Now, is there any syndrome of arrhythmogenic right ventricular cardiomyopathy? Can it be associated with any syndrome which has been a previous year question also, and that syndrome is known as these three things together. Now guess, if the person has right ventricular cardiomyopathy, along with that the child has woolly hair, and along with that the child has keratoderma. What is keratoderma? So kerato means keratin, lot of keratin. Look at the hands and look at the feet of the child. They are very, very thick. So there's thickening. Why are they so thick? Why is the skin so thick? Because there's a lot of keratin that is depositing in the skin. So we call it keratoderma. Remember, these three things together, as I can see the answer coming across, is known as the Naxos syndrome. Repeating, there is right ventricular cardiomyopathy with woolly hair, with thickening of the skin. This is known as Naxos syndrome. The next question that came in the paper was, which mutation is Naxos syndrome? So this is a defect in plakoglobin. Naxos syndrome is a defect in plakoglobin. That has been a JIPMER exam question. Coming back, this would have been your most important differential diagnosis. Then they might ask you as a, as a microbiology question, that is there any myocarditis? In that myocarditis, in that infection, in that inflammation, fat comes in the heart. So diphtherial myocarditis in some cases can show fatty infiltration. So finally, like I said, if I see fat in the heart, either you think of cell injury and Tiger defect, or you think of right ventricular cardiomyopathy, or you think of diphtherial myocarditis. Over here, since right ventricle was classically affected, I obviously thought more in favor of right ventricular cardiomyopathy. I hope this was a good question. Many of you are back on track. In fact, the second case also that I've got has been a case for the students appearing for the INI-CET. So I've got three images. I hope all three of them are visible to all of you. Photo 1, 2 and 3, correlate all of them together and tell me what is your tentative diagnosis. This has been a previous year question. Answers awaited. If you need the organ, although from here it's clear, you can see these folds. This happens to be the intestine. This happens to be the intestine, which was very clear because you could see these villi also. So very good. I've got an answer from Dr. Sajil, and that is mantle cell lymphoma. Dr. Sumit also says that, okay, everyone believes mantle cell. But the mantle cell, I agree with you. That I could have answered looking at this labeling also. Because cyclin D1 always tells me that it is mantle cell lymphoma. But what is this condition? So first and foremost, let's look at each picture. Now, some of you say FAP. See, let's look at picture number 1 first, okay? This is the intestine, I know that. And can we all see polyps in the intestine? Yes, I can highlight numerous polyps in the intestine. So my first finding is polyps. On the basis of this polyp, many of you are calling it FAP. On this picture, even I would have called it FAP. Undoubtedly, I'm with you on that. But I had to also look at the other photo. So when I look at this picture out here, I say that, okay, yeah, these are the villi. I can see the intestine component here. But I can see some blue masses. Can everyone appreciate these nice blue color masses? This tells me it's some blue. Very blue means lymphoid population. This tells me that there is some kind of a lymphoid population. So now I want to find out, ये वो normal वाला lymphoid है? Is it like a Peyer's patches? Is it a normal lymphoid kind of a thing? They are not so much in abundance. So my best way is that I'll put a marker. I'll put a marker, and I found, first tell me the technique. What is this brown color technique? Cells are coming brownish in color. In pathology, the brown color technique is IHC. IHC means immunohistochemistry. Immunohistochemistry. So we call it IHC, right? And they have said that IHC is positive for cyclin D1. I know cyclin D1 is a marker of mantle cell lymphoma. So now my going retrospective, it is a case of mantle cell lymphoma, but how has it presented? It's presented as polyps. So what do you call the disease? I'm still waiting for the name of the disease which I haven't got. So now when you get back and see your previous year question, there is something known as lymphomatoid polyposis. That is the exact question that came in the exam. Lymphomatoid polyposis is associated with which lymphoma? So see, polyposis tells you lots of polyps. Lymphomatoid tells you something to do with lymphoma. So lymphomatoid polyposis is associated with mantle cell lymphoma. This was the question of INI-CET, and you'll say that, ma'am, in the exam I might not be able to identify. So in the exam, what is your trick? Your tricks are the polyps and the cyclin D1 positivity that has been mentioned. Done with this question, let's move on to the next spotter. This is an easy one, I suppose. Just a quick identification of the instrument that you guys need to do. Waiting for an answer. Identify the instrument. This is used, I'll give you a hint, it's used in the hematology lab a lot. Hematology lab means this is a manual blood cell counter. This is a manual blood cell counter. Very good. So this I expected all of you to know, and you guys know this. So over here this looks something like a piano key. So every key is for one cell. Like for example, this key is for neutrophil. This is for lymphocyte, this is for monocyte, this is for eosinophils, this is for basophils. So every key, you have more keys also. There are some 8 keys, 10 key counter also. So more keys can also come if you want to count blasts, you want to count myelocyte, metamyelocyte. So there are lots of keys that can come. Basically, this is a quick way of counting the cells. Rather than writing down on a pen and paper, you keep pressing these keys and you can count that how many cells, how many neutrons are there, how many lymphos are there. So manually, we do it ourselves. It is a manual blood cell counter. Manual CBC counter, that also works well. Okay, coming to the next picture. This is for the second years. It's a spotter, but very, very, very important. All 3 pictures taken together. Gross microscopy fluid. It's a classical case of echinococcus. Hydated cyst, very good. So first let's go one by one. Kya dikh raha hai? When I say hydated cyst, there has to be a cyst. So what is there? There is a pearly white cyst. There is going to be a pearly white cyst that is going to be present. Okay. When I look at this pearly white cyst under the microscope, I see this pinkish appearance. It looks as if someone is painting. It's a stroke of paintbrush, this entire thing. So we call it the paintbrush appearance. Remember, paintbrush appearance is of which part of hydated? It's the cyst wall. The wall of the cyst is going to give a paintbrush appearance. NEET PG students and FMG students, this has been your previous year question. Paintbrush appearance of the cyst wall is seen in which particular infection? It is seen with hydated. Finally, every cyst will have fluid in it. So if I see the fluid, I will see that the fluid shows you the presence of this. What are these? These are said to be the hooklets. And there is something very interesting. If I ask you, okay, it looks like a hook, it is definitely a hooklet. Is there any special stain for a hooklet? Remember, hooklets of hydated are Zn positive or they are acid fast. They are Zn positive or acid fast. This is something again that you should be knowing. So all in all, this was a case of echinococcus granulosus or hydated cyst. Okay, one question for second years. In echinococcus granulosus, what is man? Man or humans? Are we the definitive hosts? Are we the intermediate hosts? What are we? Echinococcus granulosus, hydated cyst, human beings kya hai? So definitive, intermediate, or something else that I am not answering. Accidental. Humans are the accidental and the dead end host. Human is the accidental and the dead end host that is going to be there. So remember, not definitive, not intermediate. Okay, all said and done. One question I've got for your revision. Let's see how many of you were a part of yesterday's late evening class and how many of you identified this from that class. Which organism is this? Intestinal biopsy organism. If you were listening carefully yesterday, you should be able to answer it. Perfect. So I think everyone was listening carefully yesterday. Acha, someone said Barrett's. Barrett's intestine biopsy nahi hoga na. Barrett's hai to esophageal biopsy hoga. First thing, maybe only on the basis of goblet cells you answered it Barrett's, but you have to correlate it with the history also, right? So what do you see over here? And I've asked you which infection. So you will see that this is a gland, and inside the gland there's an organism, this comma-shaped organism. This comma-shaped organism is there in the lumen. That's the first hint. We have an intraluminal organism, and this intraluminal organism either is said to be of the sickle shape or is said to be of the comma shape. Same way over here, you'll say, ma'am, there are some bunch of organisms present here as well. This is also a case of Giardia Lamblia. Perfect. Everyone's got a right answer. Giardia Lamblia. So giardiasis is going to come like this. Perfectly put up. I think I don't have anything more to teach you. But there's one thing. This is the pathology picture, because this is the intestinal biopsy that I had mentioned. If I would have shown you a picture in microbiology, this is your favorite angry man appearance. The favorite angry man appearance that all of you say. So you will say, yes, ma'am. This is the typical, like, what sample is this? This is most likely a stool sample. This is most likely a stool sample, and we get that classical angry man appearance. Yes? Okay. Now, having said that, even if you look at this angry man appearance that you have, this is only the front view. This is looking at the organism like this from the front view. If I look at it from the side, this is the front view. Now I say I'm looking at it from the side. So from the side here also it's looking like a comma or a sickle. Agreed? So the front view or the antero-posterior view definitely makes it look like an angry man. But the lateral view that we are talking about certainly makes it look like a sickle or a comma shape. So that is exactly what he was seeing in the pathology sections also. This Potter is done. Let's move on to the next one. I don't want to give you any history as of now. Let's see if you guys can identify. Two pictures, they're showing the same thing. Identify any one that works for you. This and this. Okay, let me ask you, is there any pattern that is very evident out here? Any pattern? Okay, so if you look carefully, how are the cells arranged? Very good. I've got something called nest word. Acha. So giant cells lag raha hai kuch kuch. Basically, why are people finding it giant cells? Because you'll say, ma'am, I can see one line over here and I can see dot 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 lots of nuclei. So that is why some of you said giant cell. But if you look carefully, this is also like this. The next one is also like this. The next one is also like this. The next one is also like this. Do you have so many stuck back-to-back giant cells? Nahi hota. Same way over here, you will say, okay, ma'am, this is, guys, for those who marked nesting pattern, you guys are right. Now, for example, I give you the history now. I say this mass is from the adrenal gland, and what is your stat answer that I get in 5 seconds? This is coming from adrenal gland, and they will always give you this history. Earlier, I was just giving you without history for guessing purposes. Every time it will come as an adrenal gland history, and this pattern is known as the nesting pattern that you see in a case of pheochromocytoma. Yes, this is a case of pheochromocytoma, but this nesting pattern is given another name. In pheochromocytoma, this is also known as the Zellballen pattern. The Zellballen pattern is going to be pheochromocytoma. So please remember one trick, a trick of pathology, that whenever we are talking about nesting pattern, I'm only using the word nesting. Nesting pattern will denote some kind of a neuroendocrine tumor. So remember, nest is for net. Nesting pattern is seen in neuroendocrine tumor. Nest is for neuroendocrine tumors. Is pheochromocytoma a neuroendocrine tumor? Yes, it is. Pheochromocytoma is a neuroendocrine tumor, hence it shows the nesting pattern. But what is this Zellballen word? Zellballen word means the same. It is the same as nesting pattern, but I only use it when I'm talking about pheochromocytoma. I don't use this word for other neuroendocrine tumors. Name some other neuroendocrine tumors. One we've said pheochromocytoma. Can I say carcinoid is also a neuroendocrine tumor? Carcinoid tumor is also neuroendocrine. So will carcinoid also show us nesting? Yes, it will. But Zellballen word I will only be using for Pheochromocytoma. Okay, I think that question is done. Only for you to identify this pattern did I get it out here. Okay, let's move on to the next question. Lots and lots of images that are coming up your way. So yes, please let me know the answer to this. 4 pictures shown you every possible internet image that you can get in the paper. It's a classical one. It's a classical one. Yes. How do I identify? Look at the clinical part. The clinical patient's mouth is open. The mucosa is showing me some pigmentation. So what do I see out here? I see the presence of mucosal pigmentation. After mucosal pigmentation, the same patient shows me a polyp. And that polyp is a tree-like polyp. It's looking like a tree, so I call it arborising polyp. I refer to that as an arborising polyp. So you will say that, ma'am, whenever you draw a tree, whenever we draw a tree, what is very, very characteristic? Barks, branches of the tree. So over here, if they ask you who is making these branches of the tree, so from below, if I start tracing from here, who is making these branches of the tree? If I look here, everyone's got it right. Yes, these branches of the tree over here also, they are made up of muscle. So these branches are nothing but smooth muscle. And that is the entire definition of an arborising polyp. Arborising polyp is made up of smooth muscle. So put everything together. If I see a patient of mucosal pigmentation and I see an arborising polyp, we are talking about Peutz-Jeghers syndrome. We are talking about PJS, Peutz-Jeghers syndrome. Quickly answer 2 questions for me. What is the age of onset of Peutz-Jeghers syndrome? What is the age of onset for PJP or Peutz-Jeghers PJS? Perfect. So the age of onset is usually between 11 to 17. After 11 years is the usual age of onset. Number 2 question, what is the genetic alteration in Peutz-Jeghers syndrome? So the genetic alteration is STK11, also known as LKB1 gene. STK11 or LKB1 gene. So repeating, there is something called 11 years and the genetics is STK11. That is a case of Peutz-Jeghers syndrome. Okay, having done with that question, let's move on to the next one. What is the technique? What are you seeing out here? Whatever information you can give me about this picture. Whatever information possible. Technique, I think everyone knows. Dr. Megha, don't worry about the PDF. It will certainly be available. What is the technique? Yes, brown color technique in pathology. Only one thing comes to my mind, and that is IHC. Can you help me know why is there a brown color? What is the color that I'm using that I'm getting brownish color over here? What is the dye that I'm using? Chromogen, dye, color. So you'll say, ma'am, some brown color, and that is known as DAB. What is DAB? DAB stands for diaminobenzidine. DAB stands for diamino DAB benzidine. I add this. Because I've added DAB, that is why every time I'll get a brown color only. Now, many of you were very confident on the marker also. You said that, ma'am, this is immunohistochemistry for HER2/neu. So, firstly, which cancer were they probably thinking of that they added HER2/neu? Whenever we have a profile, whenever the examiner says that I am adding 3 things, I am adding ER, I'm doing immunohistochemistry for estrogen receptor, for progesterone receptor, and for HER2/neu. Estrogen receptor, progesterone receptor, HER2/neu, we are obviously talking about breast cancer. How do I differentiate? You say, ma'am, this will also give a brown color, this will also give a brown color, and this will also give a brown color. So how do I get to know examiner ne kya bola hai? 99% of the cases it will be labeled. If it is not labeled, that it is ER, PR or HER2/neu, remember the brown color in ER and PR is going to be nuclear, whereas the brown color in HER2/neu is going to be in the membrane, is going to be membranous. I'll show you. See, for example, if this is a cell, this is the cell that we are talking about. So if the brown color comes out in the membrane of the cell, rest of the cell is not brown. If the brown color comes out in the membrane of the cell, you call it HER2/neu. If the brown color comes in the nucleus of the cell only, only and only in the nucleus. So repeating, if this is the cell and this is the nucleus and the brown color is coming only in the nucleus, you call it nuclear pattern. I'll show you some pictures. Have a look at the one that I gave you. So if you look very carefully, you'll say, ma'am, if this is a cell, if this is one cell out here, I can see the brown color is in the membrane. Nucleus beech mein khali hai. The nucleus is blue. If I see the membrane, everywhere the membrane is showing me a brown color. So this is definitely HER2 right? And having said that, estrogen and progesterone, both of them, look at their color. You'll say, ma'am, the round nucleus is coming as positivity. So yes, Dr. Sumit, they are nuclear receptors, exactly. So nuclear receptors are the ones which are going to give a nuclear positivity. So PR also gives a nuclear positivity. ER also gives a nuclear positivity. That is how we analyze the case of ER, PR and HER2 for a case of breast cancer. Okay, I hope this question is done and we can move on to the next one. For the next one, I have a hint for all of you. What is coming to your mind? What are the two main things which are coming to your mind as soon as I show you this correlation? So obviously we can see something like, okay, very good. So cat scratch, okay. Number one coming to our mind is cat scratch disease. Perfect. Anything else? So cat scratch disease basically says what is the organism coming to your mind? Which bacteria, virus, parasite, what is coming to your mind? For cat scratch disease, Bartonella Hensley, amazing. So the first thing coming to your mind is Bartonella Hensley. So when Bartonella Hensley causes cat scratch disease, number one, what is the granuloma that you see? Can anyone answer that? When Bartonella Hensley causes cat scratch disease, the granuloma noticed is a star-shaped granuloma. We see a star-shaped granuloma referred to as a stellate granuloma. That's point number one. The first thing that you see is stellate granuloma. Anything else? What? Any blood vessel problem that Bartonella Hensley causes? One is cat scratch disease. Okay. Any blood vessel problem that it causes? There is something called Bacillary Angiomatosis. This is something again I expect in NEET and INI-CET, not in FMG. Bacillary Angiomatosis means a lot of blood vessel proliferation. Bacillary Angiomatosis is caused by Bartonella Hensley. So remember these two diseases. Number one is cat scratch disease. Number two is Bacillary Angiomatosis. If I ask you now that for this Bartonella Hensley, can you help me with a special stain? And what will your answer be? Can you help me with a special stain out here? What is your answer going to be? Warthin Starry Silver Stain. WSSS. Let me show you a picture. When we are talking about Bartonella Hensley, we are going to see the presence of WSSS positivity. What's the rule? Silver stain. As soon as I say silver stain, the color that I'm expecting is black. So all these organisms that I'm seeing over here, the blackish color ones, all of these are going to be Bartonella Hensley. But provided I'm giving something like a cat scratch or that kind of a history. So Warthin Starry Silver Stain is number one for Bartonella Hensley, we studied, and the more common one. What in the stomach is Warthin Starry Silver Stain positive? That is going to be H. pylori. Yes, so Dr. Megha, as we said, Warthin Starry Silver Stain serves both the purposes. The only difference is that what history has the examiner given me. Cat scratch wala history hai ya stomach wala history hai, that will make me decide that what am I supposed to answer. So that is exactly the next spotter. If I say, guys, this is a gastric biopsy, now what is your answer? This is a gastric biopsy and I have used Warthin Starry Silver Stain. So now you will say, okay, now the black organisms that I'm seeing over here are obviously a case of H. pylori. So like I said, in the earlier case, I gave you history of cat scratch. So ye wala diagnosis tha Bartonella Hensley. Here I gave you the diagnosis of a gastric biopsy, the site. So your diagnosis becomes H. pylori. Okay, let's move on to the next one. First, let's see your observation. क्या दिख रहा है? Anything that your eye can catch, try to look at every cell one by one. सारे cells देखो. Let's see if you're able to catch it. I'll give you 10 seconds, no history. After that, I'll give you a history. Very good. Some of you have been able to catch it. For those who haven't, I'll pinpoint. What am I exactly wanting you to catch? I'm wanting you to catch this cell. What is this cell? It's a cell that shows you a line through it. It's a cell with a line, and that is coffee bean appearance. That is a coffee bean nucleus. Either in the exam, the photo will be given, or in the exam, the word coffee bean nucleus will be mentioned, or if they don't want to be so direct, they will say that they are talking about nuclear grooving. So when we say nuclear grooving, you should know that yeah, there's a nucleus and there's a groove that is going through it. So nuclear grooving out here. Okay, so now can you tell me all the conditions where I see a coffee bean nucleus? All the conditions where a coffee bean nucleus is noted? Yes, so let's go organ wise. I think that is the best. Number one, guys, if I talk about thyroid, what in the thyroid comes to your mind which has this coffee bean nucleus? I think this is everyone's favorite answer. Papillary carcinoma, thyroid. Next, if I ask you for the ovary, what in the ovary is coming out to be? Two things, two tumors of the ovary which have a coffee bean nucleus, that everyone has answered. Number one, granulosa cell tumor. And other than granulosa cell tumor, there's going to be a Brenner tumor. Granulosa cell tumor and a Brenner tumor. Next, what do you see in the bone? Anything in the bone? Very famous tumor of the bone, which is a mandatory question, is going to be chondroblastoma. Amazing. Chondroblastoma. And one more thing that presents as a coffee bean appearance in the bone only, Langerhans cell histiocytosis. So repeating, papillary carcinoma thyroid, granulosa cell and Brenner tumor, chondroblastoma and Langerhans cell histiocytosis. All of them show you the coffee bean appearance. Now, having said that, when I come back to this question, can you tell me which of these have I shown you over here? Can you guess? Because other than coffee bean, are you guys seeing something else? Other than coffee bean, anything else that you can see? Okay, so I don't want to show you the answer, so I'm definitely going to, shut this off so that you don't get to see the answer. Yes, please let me know, guys. Okay, you say blood vessel. नहीं, इसमें blood vessel तो नहीं था. Anything else? Anything else? You got a list. You've already got a list of all the coffee beans. Now you just need to let me know from that list that what is coming to your mind. Okay, did you also notice everyone is the screen back for us? Just a second. Is the screen back for us? I hope yes. So did you all notice that there was some cell over here which was orangish, bright orange, pink? कुछ ये अलग सा area दिख रहा है? This bright orange, pinkish cells. Everyone, yes or no? What are those cells? What are those cells? Think of a blood cell which is orangish. कौन सा वाला blood cell होता है which is orange in color? That is an eosinophil. The only blood cell which is orange is eosinophil. Now think logically that if you have a coffee bean appearance and you have an eosinophil, you are talking about an eosinophilic granuloma. You are talking about an eosinophilic granuloma, which means you're talking about Langerhans cell histiocytosis. Eosinophilic granuloma, तो eosin है plus LCH है, तो it will show you the coffee bean appearance. But don't worry, this will never come as a spotter. How will you get a history of Langerhans cell histiocytosis? Usually they'll give you some kind of a child and they will say that there is a bony lytic lesion that is present. Now that's also a good debate that we can have. Bony lytic lesions is a never-ending topic, but I'll give you some key pearls to answer bony lytic lesions. Okay, उसमें क्या कैसे approach करना है? How do you have to approach a question when they say that there are some bony lytic lesions? First and foremost, focus on the age. Either they will mention something like a child, and they will mention something called an adult, right? अब child है, so most likely in the child, the bone that will be mentioned will be the scalp. So the scalp bone will be mentioned. A child with bony lytic lesion, you think of Langerhans cell histiocytosis. Number two, if they say adult, think of two things. Number one, multiple myeloma, bony lytic lesion, 55, 60-year-old person, multiple myeloma, or anything else coming to your mind? Multiple myeloma to obvious tha. Can it be Cancer metastasis? Can it be like, say, prostate cancer coming into the bone, breast cancer coming into the bone? So, or some kind of cancer, thyroid cancer, kidney cancer, intestine cancer. So, some kind of cancer coming into the bone is definitely a possibility, or more common is multiple myeloma. In children, LCH. This is like 90% of the cases, this protocol is going to work for solving your questions. Okay. After this question, let's go to a very easy wala question. Again, for the second year students, what do your eyes see over here? What do your eyes see over here? Something over here that you want to mark? Okay, this is an easy one. Then I'll take you to two tough ones. Okay, easy one. Everyone identified. You'll say, ma'am, this was a cell. This was the nucleus of the cell. And apart from the nucleus, you have this brown color pigment called perinuclear halo. Or perinuclear pigment. You have something called a perinuclear pigment. And I see the color of that pigment. It's a brownish shade that I have. It's a classical case of lipofuscin, because if they ask you what is the location of lipofuscin, this word is golden. Lipofuscin is always around the nucleus. It is perinuclear in location and what in color? Brown in color. At what age do you expect this kind of a picture to be given? It's an old age pigment. It's a case of senile pigment, old age. So there'll be some 83, 85, 90-year-old person who will be mentioned to you out here. So this was the easy one, as I said. Now let's go to two tough questions. Guys, can you identify the stain and the pigment that they want to show you out here? Stain and the pigment that they want to show you out here. Okay, some of you say pearls. Maybe because you're seeing the blue color, so pearl seems the right option. What I'll do, maybe the orientation is not too good with this picture. Let's change it. Let's change the orientation to this. कौन सा organ? Organ identify करो. कौन सा organ लग रहा है? Identify that. Can you see that this is looking something like the epidermis and this is looking like the keratin? Yes. Is it looking something like the skin now? Now that I've changed the direction, correct? So if it is the skin, I don't think of the pigment being iron in the very first place. If I call it skin, the first pigment that will come to my mind, I'm not saying iron cannot deposit, it can, but going by common sense, the first pigment coming to my mind is melanin. In skin, I think of melanin. And where do I expect the melanin? Derma question. Melanin will be in the top layer or melanin will be in the bottom layer? So melanin is something in the, this is the area. The basal layer is where melanin is expected. In the stratum basal, the melanin is expected. And if you look carefully, the entire basal layer is showing you this different color. Because for melanin, the stain that I've used out here is the Schmoll stain. So firstly, it's very easy to remember that Schmoll sounds like mole, right? It sounds like mole. So mole jo hoga, that will be for melanin. Mole is going to be for melanin. Schmoll stain is for melanin. And what color does it give you? If you can learn the color, which is evident over here, it gives you a nice blue-green color. This was one tough question, but I hope now it's easy for all of us. The next tough question is this. For this, I will have to give you a history. This is a brain biopsy. This is a brain biopsy, and you can see some two cells, which two nahi, in fact, all of them you want to encircle. They all look the same. So what exactly do you want to answer these as? Brain biopsy. I'll give you a hint. It's something to do with an infective etiology. Okay, caterpillar. Someone said caterpillar. Firstly, caterpillar is something I see in some other disease and some other organ. Caterpillar cells are seen in rheumatic heart disease. Over here, I've given you the history of a brain biopsy. So, I agree caterpillar can look like this, but heart ka history hota. So, that is not here. What else? Okay, firstly, if I want to call them rod cells, will you agree with my description? Yes, rod cells, you'll say, yes, ma'am, ye elongated hair like a rod. Now, any disease coming to your mind? Any disease coming to your mind for rod cells? Toughest question I can say for the day. Again, I would want to end or come towards the end also for INI-CET only. Acha, some of you say, ma'am, microglia. Some of you say microglia. Microglia, you are right. Dr. Swati, microglia kya hai? Macrophages? Do you agree that microglia are nothing but macrophages of the brain? So these are nothing but macrophages which have been modified. Macrophages which have been modified. Matlab, instead of looking like this, they are looking like this. ये modification हो गया है. Finally, we've got an answer. Correct, Dr. Swati and Dr. Megha. This is a case of neurosyphilis. This is a case of neurosyphilis. So this has been, see, only thing is, I gave it to you as an image. So they will always ask you regarding rod cells. Rod cells, लिखा भी होगा, photo भी होगा. Both of the things will be there, or either one of them. So rod cells that the photo shows you over here, firstly, what are rod cells? You'll say, ma'am, they are nothing but modified macrophages. Number two, where are they seen? They are seen in a case of neurosyphilis. Now, I was having one answer which everyone was very fond of. Everyone was calling it Rosenthal Fibers. Actually, the concept is that anything you see in the brain which looks a little elongated like this, we have a habit of calling it Rosenthal Fibers. Okay, not a bad guess, but you forgot the color, guys. Rosenthal fibers are pinkish in color, whereas here the entire nucleus, instead of the nucleus being round, instead of the macrophage being a round nucleus, the nucleus was becoming a rod. So you saw the color out here was blue. It was not a Rosenthal fiber. The background is pink and that is not fibrous. So that is not the Rosenthal fibers. Everyone's favorite, I know, is this answer, but remember the color. And if you were talking about Rosenthal fibers, the first thing that I mentioned was कि ये tumor नहीं है. When I showed you this picture, I said it is something called an infective etiology. Then why did you think of Rosenthal fibers? Because Rosenthal fibers are very famous in a tumor. Which tumor are you talking about? Juvenile pilocytic astrocytoma. JPA, juvenile pilocytic astrocytoma. So the first thing that I mentioned over here was that it's not a tumor. If I said it's not a tumor, you shouldn't have thought of the Rosenthal fibers in the first place. Okay, having said that, I think there's one or two image that I'm still left with. Easy one. I think this is the last one of the day, which is an MCQ based one and a very super easy one. 32-year-old female using intrauterine contraceptive device on a pap smear examination shows the presence of the following finding. Which of the following best describes the same? Actinomyces, Gupta bodies, dust bunnies, or all of the above? Okay, so we had to end it on our favorite option, all-time favorite, and that is going to be the all of the above wala option. So when I look at these pictures, just a second. Yes, when I look at these pictures, I realize that there is something over here which is looking filamentous. Something over here which is looking as if it's making filaments over here, right? If I look at the second picture also, I'll see, yes, again, there is something fiber, like a cotton ball. Everyone has seen the cotton fibers, right? So lots of names given to it. Either you call it the cotton ball appearance, or you'll say, ma'am, wool also looks like that. So you call it a woolly ball appearance. So cotton looks like that. Wool also looks like that. Gupta is the scientist. So Gupta bodies, scientist ko to credit dena padega. So Gupta bodies is another name for it. Because it looks like very dirty, dusty particles. So dust bunnies is another name for it. And all of these are nothing but which organism? Actinomyces. So this is all of the above. Remember, all these names stand for actinomyces. Cotton ball, woolly ball, actinomyces, Gupta bodies, dust bunnies. Everything is the same. Dr. Aditi, like I said, Gupta bodies is the same thing. ये सब सेम चीजें हैं, कोई अलग अलग नहीं है, only scientist. अब थोड़ा scientist को credit तो we have to give, right? So all of these are the same. Gupta bodies, dust bunnies, actinomyces, cotton ball, woolly ball, ये सब same चीज है. And more so, even if you didn't identify the picture, whenever on a pap smear they say there's a use of IUCD, intrauterine contraceptive device, the first infection coming to my mind will always be actinomyces. For IUCD, actinomyces is very, very, very common. And yes, with that, we can wrap up the session because this happens to be the last spotter. All of those who are worrying about the PDF, please do not, because I'll be sharing the PDF over the Telegram group, number one. And today, by the end of the day, I'll be sharing another PDF of the must-know topics that I have told you guys about. So that I'll also share over Telegram. And Dr. Sajil, attend special classes, should we make notes or approach with PDFs? Honestly, Dr. Sajil, I feel notes are something everyone has nowadays, either because of printed version or already from different apps and everywhere, or from coaching classes. Set of notes everyone has. That's very handy. So making notes again from my PDFs, I would not suggest would be a very wise decision, because see, most of my notes are anyway handwritten. I've written them out. They're not typed, right? They're handwritten notes. So either you can take a printout or you can save it as a PDF, and that saves you on a lot of time. So my personal advice to you would be that you can make use of the PDFs directly, but obviously it's all about customization. It's all about personal way of studying. If you feel that you cannot study from someone else's notes, you're not able to remember it, then you'll have to give in that extra time and effort, because making notes is one of the most time consuming things that one has to face, right? So if you can manage that time along with your revision, then certainly. But if you can do with the PDFs, I think you will save on a lot of time, energy and effort. Okay, Dr. Vignesh, PDF notes are available from the Plus classes. All the Plus classes, you can download the PDFs right after the class. So whatever class is conducted, or if you go back to see any recorded session, you can just download the PDF from every session. So if there are 20 lectures, you can download 20 PDFs and the entire course is in front of you. Okay, so Dr. Megha, I'll look into it. Why were you banned? I'll definitely look into it. And before I end, today is the last day, guys, July 31st, the last day up till 12 midnight for the special discount offer that is going on. And in case you wish to join, please use the code PATHO10. So after tomorrow, this particular discount would not be available. Okay, so thank you so much for joining in. Have a great day. Have a great Sunday. And I will definitely be posting these PDFs that I've told you on the Telegram.